gears, answer some of your questions at home. We're joined by a local expert on this stuff, Dr. Erika Hamilton, a microbiologist from UMass Amherst. Hello, Dr. Hamilton. Hope you're well.
I am well. I hope you are too.
I am, and we are overjoyed to have you because we got some good questions for you today. And the first goes, with restaurants slated to reopen next week, what precautions should we take with outside dining?
Restaurants are supposed to be following some pretty strict rules when it comes to reopening, whether it's indoor dining or outdoor dining. And so when you go in, you'll see things like tables really well spaced apart. You will not be able to have more than 6 people at a table. So if you have a large family or wanted to get together with friends, you won't be able to have more than 6 people at once. And common traffic areas may have plexiglass up, or they may be altered a little bit so that your trip to the bathroom or going to a cash register, something like that, may be different. When you go, bring your hand sanitizer, wear your mask, and then obviously you can't wear a mask and eat at the same time. So when it comes time to actually eat your food, you'll have to take it off. When you're done, use your hand sanitizer when you go to leave. And if you have to use the restroom, make sure that you wash your hands thoroughly after you're done there. And also, wait staff is not going to be as close to you, I think, as they normally would be. So be prepared for your wait staff to be standing a little bit further away. So there'll be a lot of different changes, but it will hopefully keep us all safe.
Yeah, that's the end goal. We all want to be safer in the end. And the CDC, you've told us before how this is an ever-changing virus. And now the CDC is saying COVID-19 was in the U.S. as early as January or February. So what does this do for those who are actually studying the virus?
For people who are studying the transmission of how the virus is moving, so these are people who work in public health or epidemiologists who study the movement of infectious diseases, what they will start to do is they'll start to go back to people in certain hotspots like California and New York and look at, were these people, who was sick before we thought the disease was here? And they'll start to look at some of these people, test them for the presence of antibodies, and maybe get a better handle on how this disease spread, where it has moved, and hopefully gain a little bit more insight into things like long-term immunity to it.
All right. And speaking of immunity, or maybe lack thereof, but linked to it in a way, the vaccine. There's a lot of talk out there about this vaccine. And the question goes, is it too early to tell if a coronavirus vaccine needs to be given annually, kind of like we see with the flu shot?
It is a bit too early to tell. It probably won't have to be given annually. We do know for people who have had SARS or MERS, they're naturally acquired immunity, so they had it. They didn't need a vaccine for it. Lasts, they believe, for at least several years, so hopefully the vaccine will last for several years. So it may not be a yearly thing that people have to get, but it may be something where you get it and then at a spaced period of several years after, you have to receive a booster for it.
All right, informative as ever. Dr. Erika Hamilton, a microbiologist from UMass Amherst. Stay healthy. All right, we're going to check back in with you here in the coming days. After all, it's only Monday, folks. We got a whole week to go. So tune in each weekday as the no doubt continues this pandemic. At 12:30, we'll have experts answer your questions about this pandemic. Okay, so